Good afternoon. Over the last several days, we've learned that Canada will be behind other major countries in receiving and administering a vaccine. Today, Reuters is reporting that Mexico will be distributing its vaccine to its population as early as December. And we've heard similar news out of the United States and other countries around the world. So when posed with this question today, why is Canada at the back of the pack of being able to distribute vaccines, the Prime Minister made the following statement. One of the things to remember is Canada has no longer any domestic production capacity for vaccines. Countries like the United States, Germany, and the UK do have domestic pharmaceutical facilities, which is why they're obviously going to prioritize helping their citizens first. This rationale is flawed and dangerous for several reasons. First of all, the issue of domestic vaccine manufacturing supply was identified as an issue after the H1N1 pandemic. In fact, in some of the best practice reports, domestic vaccine manufacturing capacity was identified as an issue. So this issue in and of itself should not have come as a surprise to the Prime Minister or to the Health Minister or to the Procurement Minister when looking at a COVID vaccine rollout plan. And we've had 11 months to look at this. So that's problem number one. Problem number two is the factual incorrectness of the Prime Minister's statement about domestic vaccine supply. In fact, in May of this year, the government announced several $1 million for two facilities in Canada that already have production capacity. $12 million set aside particularly for COVID vaccine capacity at Vito Intervac at the University of Saskatchewan, as well as $44 million to expand a national research council in Montreal so that it could manufacture vaccines. At the time, the government, led by Justin Trudeau, said that a facility will allow the lab to produce 70,000 to 100,000 doses per month with expansion after that. So I find it very curious that the Prime Minister said that there's no domestic manufacturing capacity. Now, of course, we may need external capacity to help bolster this. But I think the real question here is, did the government negotiate the capacity with the contractual agreements with manufacturing companies like AstraZeneca for the vaccine to be manufactured in Canada, even at these amounts? In fact, this question was asked at the Health Committee on Friday to health officials. The question that was asked was this. I know that certain drug manufacturers like AstraZeneca have given countries like Brazil, Japan, Australia, and industry the ability to manufacture the vaccines themselves. This, of course, will speed up vaccine manufacturing and also help secure access to any vaccine to their citizens. Has Canada negotiated this same right with AstraZeneca to produce the vaccine ourselves in Canada? The health minister turned the floor over to her officials, who said the following. So far, Canadian domestic manufacturing capacity has been focused on Canadian vaccine development, companies like VBI, for instance, as opposed to international companies. A follow-up question was asked. Of the promising vaccines from Pfizer, Moderna, or AstraZeneca, has Canada negotiated the right to manufacture those vaccines here if any of those vaccines are approved by Health Canada? The health officials said the following. Our relationships with them are to procure their vaccines and to have them manufacture and deliver them to us. They have not asked us to manufacture vaccines for them. I think that there are a lot of questions that are outstanding for the government here, including whether or not they had the capacity to manufacture these vaccines here in Canada. The answers that were given by the Prime Minister at Rideau Cottage today are unacceptable, and we certainly will be pressing officials for further answers in coming days.
We'll now take questions. We have about 10 minutes for questions, starting in the room with Rachel.
Hi, Ms. Rempel. You certainly covered a lot off in your statement there, but I guess what do you want to tell Canadians right now who are waiting at home and, they think, okay, well, everyone else is getting a vaccine, we should be getting one too. But now there seems to be all of these issues with approval and delivery. So what's the main thing you want to tell Canadians?
3 points. First of all, the government should explain when we are going to be getting vaccines. Because until we have that information, there's no certainty for Canadians. And I think that's leading to a lot of mental health issues. It's leading to business closures. The government needs to come clean on that, number one. Number two, if we are behind the pack in other countries and we're not going to be getting vaccines for months and months, like let's say most Canadians aren't getting vaccinated until the later part of next year, sustained economic lockdowns can't be the solution here for two reasons. They're not working. They're not working. We're seeing, if they were working, why would we see spikes in COVID numbers, right? And also, there's a lot of corollary impacts of economic lockdown, be it mental health, job loss, etc. So today, the reason why I lay all this information out is that the government is asking Canadians to trust them with a lot of things that they're asking them to sacrifice, right? They're asking them to trust them on their response. They're asking them to trust them to just keep sitting at home, to be isolated, to cancel their Christmas plans. And if the government is asking Canadians to trust them, then they have to provide transparent, accurate information to Canadians so that trust relationship can be built. And I think that on all accounts, the Prime Minister has failed on this. So what we need in the interim is widespread access to frequent, rapid, and at-home tests so that we can have targeted isolation measures that more effectively prevent the spread of COVID-19, rather than simply asking Canadians to sit at home for months and months on end without any hope or clarity of how this is going to come to an end. And that is what Canadians need to know, and frankly, what they need to be demanding from their leaders.
And when you mentioned rapid tests, I mean, in Ontario, the federal government has delivered rapid tests, but I think there was an announcement today that they're being rolled out. But before that, they were just sitting in storage. I mean, is there a concern that that same thing could happen with vaccines, where the government is able to get vaccines, but then on a provincial level, they just stay there, they don't actually get delivered?
I would challenge the premise of that question. Rapid tests have not been rolled out in Canada in any meaningful way. For rapid tests to be able to work, they need to be widespread and frequent. You and I should be able to walk down to the pharmacy and get a test result within 15 minutes several times a week, and there's just not that capacity anywhere. And furthermore, at-home tests, which Dr. Anthony Fauci in the United States said could be a game changer in stopping COVID in its tracks, the government doesn't even have a manufacturer on their review list right now. And, you could buy them in the U.S. at this point in time. So that's, I just don't agree with that assertion. And I also think that, there is a good point in that, these vaccines are going to, you can't just stockpile these vaccines, from my understanding, right? Because they have storage issues. It's not like there are tests that can just kind of stay there, which is another reason why we need to have answers on the capacity for Canada, what capacity we actually do have to manufacture here at home. For the Prime Minister to walk out of the cottage today while he's working from home, while many Canadians can't, and say that there's no production capacity is factually incorrect and is a lie. There is some. So the question is, after putting all of this money into it that his government signed off on, why is he saying that this isn't even a possibility for us, that we couldn't even be doing real-time, on-demand manufacturing for super high-risk populations like healthcare workers or people in long-term care facilities? There's a lot of questions that need to be asked in coming days, and I certainly hope that Canadians work with us to press the government for answers.
We'll check if there's any question on the phone right now. Operator?
We have one question from Marique Walsh from the Goldman Mail. Please go ahead. La parole est à vous.
Hi, Ms. Rempel. Thank you for taking our question. Can you just clarify what testing capacity you're referring to that you say exists that the Prime Minister isn't acknowledging?
There's many examples of this, but the pertinent information I'm referring to is in a National Post article published on May 13th, 2020. And it's talking about government investments related to COVID vaccine domestic production. And it says the government has made two major investments to forward vaccine production. The first was $12 million to the University of Saskatchewan's Vaccine and Infectious Disease Organization, Vito Intervac, and also that there was $44 million to expand an NRC facility in Montreal so that it can also produce vaccines. The government said the facility will allow the lab to produce 70,000 to 100,000 doses per month by summer, with more expansion after that. So if this was supposed to be done by the summer, why is the Prime Minister saying that there's no domestic manufacturing capacity? And why are department officials saying that they hadn't negotiated these rights with the major vaccine producers?
Follow-up?
And so given where we are now, given, I guess, the state of play that the Prime Minister says that we don't have this capacity, where would you like it? Like, what is the first step the government needs to take now? Or is essentially the goose cooked? Like, is what's happening just going to happen? Or is there a way to change it?
This is gross incompetence. And this is gross incompetence that's going to cost Canadians their lives and their jobs. That's a question for the Prime Minister. We'll just keep pressing for answers.
Another question from the room.
Yeah, I mean, a lot of the questions too today were about a plan for, hypothetically, once we actually do get the vaccines and they're ready to be delivered. We still haven't heard from the government about how exactly they're even going to get to Canadians. So I'm just wondering about your thoughts on that, and if you have concerns that they're not even planning right now for a potential delivery.
I have concerns. We had the health minister in front of our committee on Friday and health officials. We asked basic questions like, I know that your network was pursuing last week around, we had the Minister of Health in Alberta and in Ontario saying that they had a certain number of doses allocated to them. The minister and her officials both openly contradicted that claim at so there's one example of where we need the federal government to be using some leadership to work collaboratively with the provinces, and there's a failure right there. We need to know things like how many pairs of gloves are going to be needed across the country? Do we have that? How many syringes are needed? Do we have that? What I don't want to hear is I don't want to watch countries around the world get vaccinated where we have no rapid tests. The government comes out of Rideau Cottage and says, I get to work at home, but you have to close your business because we don't have rapid tests. We don't have a plan for vaccines. And also, the government by this point should be rolling out an education plan to the Canadian public on the vaccine, on its benefits, on where to get it, what it means, how many doses they're going to need, who's most at risk, why they've made these criteria selections. None of that information is available. And if other countries are going to be starting to do this in the next 2 weeks, where's our plan? This is beyond the pale. And to make such a ridiculously audacious statement after spending millions of dollars on Canadian domestic production, that there isn't domestic production capacity, we can do better. Thank you.
I'll check one last question on the phone, if there is one.
There are no questions registered at this time.
There you go. Thank you.